This portion of Carlos and Lisa is brought to you by Scan Health Plan.
We're delighted to welcome back our friends David Milligan and Holly Ackman of Scan Health Plan. I know that people, when turn 65, they become eligible for health care coverage through a federal government program called Medicare. But from what I understand, the process for how individuals sign up to receive these benefits can be a bit confusing. Isn't that the case, David?
Absolutely. Like so many things, even though the process is rather straightforward, knowing where to start and who to go to with questions can be confusing.
And Holly, that's exactly why SCAN is sponsoring these segments, right? To help educate seniors and their caregivers on the fundamentals of how their options for Medicare work.
Yes, Carlos, it certainly is. As you know, SCAN is the second largest not-for-profit Medicare Advantage plan in California, and our mission is to keep seniors healthy and independent. Helping folks understand how to enroll in Medicare and get their Part A, hospitalization coverage, and Part B, coverage for doctor visits, is a very critical aspect of ensuring that seniors get the health care coverage to which they are entitled.
And Carlos, especially in the current environment for your viewers who are 65 and older, some of them may not have applied for Medicare coverage because they were employed and receiving health insurance through their employer, and then suddenly find themselves unemployed and without health insurance when their employer was required to close their business. These folks need to get their Medicare coverage as soon as possible.
Well, that's a perfect example for us to start with. What do those people need to do?
If they're age 65 or over, but not receiving Social Security benefits already, they must sign up for Medicare on their own. They contact Social Security to start the process. Now, with the current environment, their local Social Security field office may be closed, but folks over 65 are encouraged by the Social Security Administration to go online to apply for their Medicare coverage.
You know, I took some notes during a previous SCAN segment, and you encouraged people who had questions about Medicare or who wanted to enroll in Medicare Advantage plans to reach out to local, independent, licensed health insurance agents who will guide them through their Medicare journey. So can these same agents assist our viewers in signing up for their Medicare coverage?
You're a good listener, Carlos, and yes, these local independent agents are not employed by a health plan. They represent all of the 17 local Medicare Advantage plans available in Southern California, and they're also subject matter experts on how to get started on the Medicare journey.
To find them, ask your friends, your pharmacist, your doctor, or another trusted advisor if they have worked with a Medicare agent that they would be willing to recommend to you. These professionals don't charge for their services. They're compensated by the health plan that you eventually choose to enroll in, and you will find them to be the trusted source for information and options on all things Medicare related, including getting you enrolled in Medicare.
And just a note, the ads you see on TV with the word Medicare in the message and hosted by celebrities, those are national agents who don't represent all of the local plans, and they aren't as familiar with the local medical groups and the hospitals as are the local insurance agents who live in your community.
Well, that makes great sense, David. Well, I so enjoy our segments with SCAN. I learn new things about Medicare and Medicare Advantage plans each time we chat, and I look forward to the next time we get together. Thank you, David. Thank you, Holly. See you next time.
Thank you, Carlos.